Top stories from around the island. To the point. Without the fluff. Puerto Rico headline news. Please subscribe and don't forget to hit the bell notification.
Welcome back and thanks for watching. This is Puerto Rico headline news for February 28th, 2020. Local newspaper El Nuevo Dia has reported that the hospitals have begun to reveal their plan of action against the coronavirus, and in doing so, they've actually also revealed suspected cases of the coronavirus in the last few weeks that have kind of been hidden from the public. So we'll take a look at that. Throughout this video, we are going to see what this plan of action is involved with the hospitals. We'll also cover a little bit about those suspected cases that have happened or occurred in the last couple of weeks. And then we'll cover the hospitals that are located on the island in Puerto Rico that are equipped to handle any suspected cases of the coronavirus. So I'm going to go ahead and go into this report. And it says here that given the growing possibility that a case of the coronavirus or COVID-19 will eventually happen in Puerto Rico, the island's hospitals have begun to prepare. So that's a good thing. Continues to say, until this week, no one knew what would happen in Puerto Rico if a patient tested positive for the coronavirus, even though there are already more than 82,000 confirmed cases. Everyone asks, should we take a suspected patient with COVID-19 to a medical center? Or will it be smarter and better to take them to a hospital that is equipped to handle coronavirus cases? Now, this was asked by Dr. Lemuel Martinez, president of the Infectious Diseases Society of Puerto Rico, and I'm sure this was just a rhetorical question. He continues to say, having hospital rooms with negative pressure is great, while the number of patients is manageable. So when there are many patients with the same disease, we will put them in groups. The most important thing is to know how to handle things when there are few cases and when there are many cases that may arise, Martinez said, adding that the Doctors Center Hospital in Manatí, where he works, there are 8 isolation rooms. So that's the first hospital, the Doctors Center Hospital in Manatí. That's a great hospital, actually, and they have 8 isolation rooms there. Now, other doctors and hospital managers interviewed by El Nuevo Dia also said that they have the necessary isolation rooms to care for these patients, as well as the personal protective equipment to protect the health and safety of the staff inside these hospitals that will be treating these suspected cases of the coronavirus. So let's take a look here and see the plan that they submitted. And here basically see that the question is, how can we deal with a suspected case of COVID-19 in a hospital? So it mentions there the patient arrives to the emergency room. In some hospitals, they're identified according to their symptoms. If they have flu-like symptoms, they give them a mask while he's waiting to be tended to. And once they enter into the triage area, then they get interviewed about their history of any travel that they've done. Then we move on to this other section. If they identify that the patient has traveled recently to a country with confirmed COVID-19 cases, they'll immediately put them into isolation. So who will be put in isolation? Well, people that arrive to Puerto Rico from China with difficulty breathing, coughing, will be immediately transferred from the airport to the well-equipped hospitals. Their plan continues. At that time, once they arrive to the hospital, they'll be administered a diagnostic test, for various diseases, respiratory, including influenza, and the mycoplasma, I believe it's called. Then the hospital staff will then notify the epidemiology department of the Department of Health via phone about the current patient that they are testing. They're also going to notify the CDC or the agency through forms that they have to fill out with details about the case that's under investigation and the patient's history. Um, then they collect the tests and they send them directly to the CDC to be confirmed if it is the coronavirus that they're looking at. What happens if it is the coronavirus? Well, the patient will have to remain in the isolation room of the hospital for a period of 14 days. Now, this might not be enough according to the latest information about the how long the incubation period is. But this is once they've already shown symptoms. So they'll be held for 14 days. And during this time, they'll receive treatment to help with the symptoms that they are having. So that's the plan of action that the hospitals have put together. Now, while they were putting this report out, it got out that they had been dealing with some suspected cases of the coronavirus. Now, what's interesting is on the 21st of February, a doctor, a well-known doctor, on his Twitter account mentioned that there were suspected cases of the coronavirus already on the island. Well, the Department of Health immediately responded to those rumors and completely denied that there were any suspected cases of the coronavirus on the island. So this was reported on the 21st of February. Well, in preparing this plan of action, the hospitals actually revealed, and I'll read what the newspaper was able to find out. And it mentions here, the El Nuevo Dia newspaper learned that in recent weeks, more than a dozen suspected cases of COVID-19 had been identified but not reported in different private hospitals throughout the island. All to date, all of them to date were ruled out since they tested positive for other respiratory conditions like influenza. Now, it continues to mention here that, however, as a preventive measure, some were placed in voluntary home quarantine for 14 days. The incubation period estimated for this virus as of a few weeks ago. Now, these cases all recently had traveled to China and to other countries with confirmed cases of the virus, such as Italy. And this is being reported by El Nuevo Dia, the local newspaper, as they were reporting on the plan of action that these hospitals had. And this is what they were able to find out. Now, it continues to say Dr. Carmen de Seda, a state epidemiologist, reported this week that there were 4 people under quarantine. She then informed the newspaper that one of them left the voluntary home quarantine yesterday afternoon. Everyone, she said, had recently traveled to China and, although they had no symptoms, were put under voluntary home quarantine. So no doubt it was good that they put them under quarantine. Not so good that it's voluntary. So one of them decided to had enough of the quarantine, and now he's out and about. Now it continues to mention here about the hospitals now that are getting prepared to handle these cases, these impending coronavirus cases. And it says here that several of the suspicious cases have been treated at the hospital Auxilio Mutuo in Atorrey. So that's one of the hospitals. We already mentioned one before, the one in Manatí. So now the one in Atorrey, Hospital Auxilio Mutuo. Jorge Mata Serrano is the administrator of that institution. And he said, "We have had suspected cases and we have followed the protocol used by the CDC," said Mata. Those cases were later ruled out for not meeting the CDC requirements to test them for COVID-19. Now, he said that the Mutual Aid Hospital has 16 rooms that can be enabled for respiratory isolation with negative pressure. So the following hospital is the Damas Hospital in Ponce. Now, they also recently had a drill when they received a patient who was originally treated on suspicion of COVID 2019. He was a patient with viral symptoms that came from New York. He was in isolation 1 day, said Dr. Pedro Benitez, the institution's medical director, who reported that there are 6 isolation rooms there. So the Ponce Hospital has 6 isolation rooms there. Now, at the Mennonite Hospital in Calle, a suspected case was also recently treated, as explained by Ruben Norat, Chief Operating Officer of the Mennonite Health System. The patient arrived about 2 or 3 weeks ago, referred by a doctor from Sidra, where the patient had come to seek medical assistance. So he went to a hospital in Sidra, and he was sent over to the Mennonite Hospital in Calle, which is one of the hospitals that is also equipped to handle these coronavirus suspected cases. Now, he said that case tested positive for mycoplasma, which is another respiratory illness. Now, among the 4 Mennonite system hospitals in Calle, Guayana, Ay Bonito, and Caguas, there are a total of 53 isolation rooms. 33 of them with a negative pressure is what NORAD reported. Now, we have Dr. Ricardo Moscoso from the University Hospital, again, another hospital that's equipped, from the University Hospital, reported that in that institution alone, they have 16 isolation rooms with negative pressure. So essentially, this is what was reported. There are plans of action. The hospitals are ready, prepped and ready to handle any of these suspected cases that appear. And another factor, or kind of concerning, is the fact that it's been about a couple weeks that they have been seeing suspected cases of the coronavirus. Some were sent to voluntary quarantine at their home, unsupervised, so we don't know what's going to result from that situation. And then obviously we have a list of hospitals that are equipped to handle these coronaviruses, and those will be listed down in the description of this video. So once again, thanks for watching. Please support this channel by liking, subscribing, and sharing our content. And we look forward to providing a live English-based newscast in the near future for Puerto Rico Headline News.